Good morning. Today is Saturday, March 20th, 2021. Today is our regular scheduled yoga therapy class through Sattik Space Yoga and Healing Studio. Today's topic is yoga therapy for better physical balance. And first, let me explain to you what does the better physical balance means. Also, yoga therapy is a conscious effort to be in a proper posture, proper shape, proper flexibility. Our experience, our research, our observation is showing that this is, remember disease, D-I-S space E-A-S-E, this is due to the imbalance of our both sides of your brain. We have a right brain and a left brain, and the imbalance is due to our regular practice. What is a regular practice? I'm right-handed. I'm using my right-handed right foot all the time. I'm not using much of my left hand or left foot, so the part of the brain which is controlling my left side is not properly working. Metaphorically, you can think like you have a bicycle and you have the two wheels. If the one wheel tire pressure is not good, the bicycle is not going to work. So in yoga therapy, health is defined as a balance of your body, mind, and spirit. So always remember, for a practitioner or for a person who has a disease, we start first with our physical body. A physical body, like what is called our structural balance, is the most important. So what is a structural balance? The first, a practice of yoga will create a few changes in your structure of the body. The first, it will create a shape. A shape of your body will be better and better. What will be the shape? The first shape which comes from a practice of yoga therapy is the spine. Spine straight. We call Merudanda Achal. So consciously you practice continuously to keeping your spine straight. Sitting down in the ground, my spine is straight. I'm sitting in a chair, I go all the way to the back, I keep my spine straight. So practice. Now you are practicing, if you're practicing with me, if you're sitting in a chair or if you're sitting in a ground, keep your spine straight. When your spine is straight, consciously you will feel that your ear, your shoulder, your hips are in the same line. If you're sitting in a chair, you will also consciously feel. That is going to start creating a balance in your body and mind. So the shape, standing up, when you stand up, you feel like it's called your Tadasana, mountain pose, or call it Dandasana, like a stick. Even in the standing posture, your ear, your shoulder, your hips, your knees, and the ankle should be in the same line. So consciously practicing keeping the spine straight brings our structural balance. Then your body and mind works together and works in synergy. That means it together. Mind doesn't work before body, and body doesn't work before mind. It is a total combination of your practice. So throughout the whole day, mentally you will be practicing with the non-dominant side of the body. Example being, I always give this example being that you try to brush with your left hand. See what will happen. When you start trying to brush with your left hand, first of all, your brush won't go in your mouth because you're used to using your right hand. So creating the physical balance, you need to start using the opposite side of your brain. And this is called neuroplasticity. That means your brain will have enough signal that you will be able to do like that. Even when you start getting your left hand to brush your teeth, which will come up slowly and slowly, even at the beginning you will see your right hand will start to move like this. Because your brain has the signal that you brush with your right hand. All the time, if you're using, like if I'm using I'm cleaning a countertop. I'm very comfortable using my right hand, but in the left hand, I'm also comfortable with the left hand. I use electric shaver. I'm very comfortable using right hand to electric shaver, but now I'm using my left hand to electric shaver. I'm literally reprogramming my mind to bring the balance back. In the same way, I'm sitting down. This is called your Sukhasa. I put your feet underneath your knees, keep my spine straight, and I sit down very comfortably. Remember, all the poses, it has stages. The first stage is called beginning. At the beginning, all the muscle contracts, ligaments tightens up, and slowly let me get to the asana pose. If I have any pain, I back off. I back off to the point where I don't have any pain, but I have a little discomfort, called a comfortable discomfort. So if you're practicing with me, just see if you can sit down in this easy pose called Sukhasa. When you're doing an easy pose, slowly, if you keep your eyes closed and include your breathing. Lung is like a balloon. It has a 4.5 liter vital capacity. That means lung can inhale and exhale total quantity of 4.5 liter, but in normal breathing, we only breathe through 0.5 liter. Breathe out first, empty your lung, take a deep breath in, then breathe out longer than breathing in. Breathe out first, deep breath in, and breathing out. Slowly and slowly, this thing is going to happen on its own. If you push it down, so if it is not going down, if you push it down, it's going to come back higher. So it has to do on its own. Once you come to the level which is called in Sanskrit Sthiram Sukham Asana. Sthiram means stillness. You have to have a stillness in your body. Sukha, you feel happy. Asana is a pose. At that moment, you change your feet. Change your feet, see how you feel sitting in an opposite direction now. And you will see you feel uncomfortable. Initially it will be uncomfortable, but slowly and slowly with the practice, the comfort will come. What is the practice? The practice is called neuroplasticity. So what a neuroplasticity is? Neuroplasticity is the changes in the brain due to repeated input. You need about 30 to 40 inputs to create the neuroplasticity. So that when you get a structural balance, you practice it. If you're practicing with me, this is called easy pose. Then you get into the perfect pose called Siddhasana. You take your heel all the way to the back. Take your one foot in the top and let your knees fall down. You can do this even sitting in a chair. Sit down in a chair and do in sequence. Very, very important concept. And you feel the level of comfort, level of ease. This is called your effortless ease. In an effortless ease, it's a treatment of a dis-ease. Remember, dis, D-I-S, space, E-A-S-E, dis-ease. So treatment of dis-ease is an effortless ease. Staying in the state of that effortless ease is your therapy. So now, I'm comfortable with this. Siddhasana, the perfect pose. Now let's see if I take to the other foot here. So that in stages, remember in stages, yoga says in stages, impossible become possible. The first, I had my right foot on the top, the left foot in the top. If you feel very tightness at the beginning, you are incorporating first, closing your eyes. The moment you close your eyes, you will feel that a slow relaxation is going to set in. The moment you're going to include your breath, breathing out longer than breathing in, a relaxation will set in. Exhalation is parasympathetic, inhalation is sympathetic. Still, see, I'm very comfortable. I have done the perfect pose or Siddhasana in both sides equally. See, both of my feet are down, both sides equally. Now, go to the next one, which is called your half lotus, Ardha Padmasana or a Swastika Asana. Take your one foot in the top and try to put it down. If you feel a little bit of a discomfort here, you can back off a little bit. Even if you have discomfort, you will back off here. Start somewhere. The moment you say, I'm not going to do it because I'm having pain, you are not going to progress. The progression will stop. So, put it here. Use the other component. You have included your closing your eyes. You have included your breathing, effortless breathing, breathing out longer than breathing in. Then you use your hand mudras. Hand is connected with your mind. Remember, hand gesture is there before you can even speak. If you like something, you say this before you can say, I like it. If you want something, say you do this before you can say, I want this. So first, if you bring a focusing of your mind, it brings your concentration on this physical balance that comes with a mudra called a Hakini Mudra. Touch the tip of your fingers. Practice with me, you will see. Touch the tip of your fingers, gently put in front of you and close your eyes. Do your breathing out longer than breathing in. You will feel the comfort of your flexibility of your body and mind. This is an emancipation. You feel released. And this mudra is so subconscious, you will be doing it without even knowing. I've seen so many people, I've seen people in a conference, they're paying attention and their fingers will be like this even without knowing. I've taken so many pictures, I have it with me. Hakini Mudra. Anxious, when the mind is anxious, your body is tight. Body is not in a balance. Remember, when both the brain is not properly functioning, body is not in a state of balance. So you have to create a mudra to calm down your anxiety. This is called a Kamshal Mudra or a Shankha Mudra. Both the hands, use the right hand to wrap your left thumb. Use the left hand to wrap your right hand. Touch your index finger and thumb, and this will look like a conch shell. Put it in front of you, eyes closed, do your breathing out longer than breathing in. You will feel the effect of your structural balance. I can even feel my breathing is becoming very slow in my rate. Breathing is becoming very deeper and deeper. And I'm feeling that my breath is almost silent. There is no even sound during my breathing. Balance it again with the opposite side. Use your left hand to wrap your right thumb, right hand to wrap your left hand, touch your index finger and thumb, just put it here. Shankha Mudra. Shankha Mudra is to control the anxiety and the restless mind. Bring that balance in a structural balance. Very important even to bring the balance to your subtle body. Subtle body is the body of your mind. Subtle body is the body which you see closing your eyes. So I close my eyes, I still can see my body. Every part of the body I can see. I'm touching my top of my head. I'm touching the left index finger with the left hand. I'm touching the right great toe. Or my eyes are closed. I can see. I am in that studio, Sattvic space. I'm entering into the front door. I'm getting into the yoga studio. I'm sitting down where I used to teach before the pandemic. Clearly I can visualize in front of my eyes. That will also bring a profound structural balance. So the same thing, the same mudra I did, the Shankha Mudra, practice and see if you can do with your eyes closed. My eyes are closed, right hand wraps your left thumb, left hand wraps your right hand, touch your index finger and thumb. This is your Kangsha Mudra, Shankha Mudra. My eyes are closed. Opposite side, left hand wraps on the right thumb, right hand wraps your left hand, touch your index finger and thumb. When you come to this state, you will feel the effect of balancing both sides. I feel so comfortable using my left hand around. I'm comfortable moving my right hand around. Try this. You will find a little difficulty initially, but you will overcome it. So again, I'm doing the opposite side then. Bring the balance to both sides of your brain. Called it Dhenu Mudra or called Shrubhi Mudra. You touch the opposing fingers of both the hands. Like right index finger touches the left middle finger. Right middle finger touches the left index finger. Right ring finger touches the left little finger. Right little finger touches the left ring finger. You touch the thumb. It will look like an udder of a cow. Dhenu Mudra. So crossing. So it's activating both sides of your brain, bringing the balance. Remember, the health is a balance of your body, mind and spirit. Opposite side. Now we start from the left hand. Left index finger touches right middle finger. Left middle finger touches the right index finger. Left little finger touches the right ring finger. Right little finger touches the left ring finger. Dhenu Mudra. So now, see, I'm comfortable. This is the half lotus on the opposite side. Now I can do this mudra with my eyes closed for my subtle body. My eyes are closed. I'm touching my right index finger to the left middle finger. Right middle finger to the left index finger. Right ring finger to the left little finger. Right little finger to the left ring finger. And the thumb. Eyes are completely closed and I can do this Dhenu Mudra for proper activation of both sides of the brain and proper structural balance. Use your other hand, which is non-dominant hand. Left hand, left index finger touches the right middle finger. Left middle finger touches the right index finger. Left ring finger touches, left little finger touches the right ring finger. And left ring finger touches the right little finger. You can't have any better practice than this. By the time you do this, you get a fully structural balance, flexibility, and you put your both the feet high up, sit down in your lotus pose. Padmasana. It is a wonderful, relaxing asana, activating both sides of your brain, bringing proper shape of your body, bringing proper flexibility. So you're flexible, you can do the called Yoga Mudra. Yoga Mudra, you can put your hand to the back, keep your spine straight, breathe out first, take a deep breath in and slowly come down. Your head will come down and it will touch the ground. So what I'm trying to show it to you, a step-by-step practice which you will do to bring the structural balance and flexibility. I hear it all the time from my friends, from the people who wants to practice with me. I could easily used to do it before. I'm too stiff. I'm not flexible enough. My body is not flexible enough. I said, no, you're not body. Your mind is not flexible enough. So you got the steps. These are the steps you practice because a physical body, the asana practice will lead you to your pranayama practice. In 8 limbs of yoga, the asana comes before pranayama. In yoga therapy, we combined even 8 limbs together. But our primary limbs which you use is your 3rd, 4th and 7th. Called asana, pranayama and meditation. It's a wonderful practice. Shape, flexibility, and what it does when you are flexible, when you're breathing, your parasympathetic activation takes place. Your food gets properly digested because parasympathetic is called calm and digest. Food converts into 7 tissues, then it converts into called ojas, which is immunity. Immunity gets better. Food gets digested, the end product is called glucose. Glucose combines with oxygen, it forms carbon dioxide, water and ATP. Called adenosine triphosphate. ATP is your energy. You feel more energetic when your body is in a physical balance, when your body is in a better posture. You feel the effect of it in your body and mind throughout the whole day. Say another balancing practice. sitting down, is your, say your spinal twist, Vakrasana. Put your feet in front. So before that, in a daily practice, we do our relaxations, we separate our toes, breathe in, breathe out. Breathe in, breathe out. When you do a little bit, these are a powerful relaxing practices. You do the relaxation practices. Take your right foot close to your left side. Use your left hand, goes out of your right knee, right hand goes to the back, hand is up here, slowly it comes down, touches your knee. Breathe out first, take a deep breath in, slowly turn your body and stay here. Breathing out longer than breathing in. If you stay here between 5 to 10 breaths, you feel a profound level of relaxation. So better structural balance. Now to the opposite side. So I'm taking the time. See, I'm here. I'm holding on to it. My eyes are closed. I'm breathing out longer than breathing in, and slowly I go in stages. Right arm will come outside the left knee. Left hand goes to the back. Right hand comes, touches the knee. Breathe out first. Take a deep breath in. Slowly look all the way to the back. Slowly bring it back. Next one is a very nice structural balance, is your called a buffalo pose or a Vaisa asana. You bend your one knee, bend the other knee and put it in the top. And this is also the beginning of called the Gomukhasana Cow Face, which is also a beautiful structural balance. Keep a note of these asanas, because these asanas are primarily a powerful therapeutic asana because of its balancing properties. Okay. Before even going to say Gomukhasana, you can do another asana here, which is called Ardha Matsyendrayan Asana. There is an English translation for this. It's the name of a yoga master, but in English it says half Lord of the Fish pose. Very good for your piriformis syndrome. If you have a piriformis syndrome, this is one of the wonderful therapies. So bring my right foot close to my left knee. My right knee slowly moves around. My left arm comes outside my left knee. The right hand goes to the back. The left hand first touches the knee, then touches the ankle, and then touches the feet. Ardha Matsya Andrayanasana. Same way you can look all the way to the back. So this really gives you a wonderful practice for yoga therapy for your structural balance. Opposite one now. Before my left knee was down, now my right knee is down. My left knee is in the top. So, what I'm doing, I'm activating both sides of my brain. Sit down, close my eyes, keep my spine straight. I do my breathing. Then what happens, this neuroplasticity sets in. And when neuroplasticity sets in, you will be sitting in this asana without knowing. It happened to me many times. I'm sitting in a sofa, sitting in a bed, or in a conference. I'm sitting even in a chair. My feet will go up and sit like this. Vaisasana. Vaisa is the name of a buffalo. Vaisasana. Left foot comes close to my right knee. The right hand will come outside my left knee. Left hand will go to the back. Hand will come to the knee, then to the ankle, then to the foot. Even I could do very easily, I can tell you that I was feeling the difference in both sides. This side which I have done felt a little bit more tighter than on my other side. Even I'm doing for so many years, I'm still a human being, and this will happen to all of us. Another wonderful structural balance, which is a profound yogic relaxation, is your cow face, Gomukhasana. So I'm going to show you from the back, so you'll be able to understand what I'm showing it to you. Most of you have practiced with me before, so you know. So same thing is going to happen. I'm going to put my one knee on the top. So here my right knee is in the top of my left knee. Right hand goes high up. Take my left hand. I hold my left hand in the elbow and put it in the center. My left hand is in the middle. Right hand drops down. I hook it. Then essentially I handshake between both the hands. Keep my spine straight, my eyes closed. I feel a profound level of relaxation. This is one of the most powerful therapeutic asana because it is from relaxation of your hands, relaxation of your wrist, relaxation of your elbows, relaxation of your shoulder, whole relaxation of the upper part of the body, relaxation of the lower part of the body. It's a profound level of relaxation response, activation of parasympathetic tone. Crossing my knees now. Now my left knee is in the top of my right knee. Left hand is going high up. Right hand is in the middle, so I'm using my elbow to put the right hand in the middle. Left hand will drop down, I'm touching it, I hook it, again, essentially I'm handshaking each other's hand. Now you notice I'm comfortable with both sides doing equally. This is what is called a structural balance. This is what is called activation of both sides of the brain. This is activation of your neuroplasticity. Keep practicing. It's a wonderful practice to continue your balancing poses. This one laying down. You can laying down, you can do a, say, balancing both sides will be your, say, Mudras or a spinal twist. So, here you are keeping your head down. Both the hands are both sides like a T. Bend your both the knees and the hip. Drop both the knees to the opposite side. I'm putting both the knees on the right side and turning my head looking to the left hand. Same thing, we're doing opposite side. Dropping both the knees on the left side and looking into the right hand. You can also do this with raising both the feet high up in a little bit more advanced poses. You both the feet high up. Both the feet goes towards your right hand. You touch your right hand and you look in your left hand. Bring your both the feet high up, opposite side. You bring it all the way down. It will come close to your left hand, touching your left hand, and you look into your right hand. This is a very nice posture. It is called the modified knee chest, called Pavanmuktasana. You hold both of your knees, drop both the feet down in the ground, your eyes closed, you breathe in and out. Let's show you a few more structural balance, standing up, and before we finish, because today's topic primarily was yoga therapy for better physical balance. Another one. This is a very important yogic practice. Able to sit down in a squatting pose. Sit in a squatting pose and able to get up without a support. When you get up without a support, bring your balance back. I'm comfortable standing like this. I put both of my feet together and structurally for balance, my ear, my shoulder, my hips, my ankle is in the same line. Even if I put my hands high up, my body is exactly in the same structural plane. You'll be able to sit. If I can go against a wall. If I go against a wall, my body will be exactly touching. My body will be touching, my heel is touching, my hips, my shoulder, back of my head. I'm in a completely straight line of my body. And you can raise my hands high up. Even my hands will also be a straight line going high up. Then you create a balance with the non-dominant foot. These are the practices we do all the time, but I'm curving out the practice so you can use it for your structural balance. When you fall down, you always fall down in your hand. So take the hand, do a prayer pose to the back. Take your hands to the back, and you can see how nice and slow and easy it is. Turn your hand in a prayer pose. Stay here. Keep your eyes closed. Breathe out longer than breathing in. And slowly you will see your hands is going to go high up and it's going to stay high up. So if you stay longer, you see hands is going to go high up more and more. But stay in this posture. In a nice balancing, you like not to do any pranayama practice standing up because it creates an altered sense of consciousness. But you can practice a very slow Kapalbhati pranayama to see your relaxation, to see your balancing process. So I'm right-footed, right-handed. See if I can stand on my left foot. I stand on my left foot and slowly I increase my time. Initially, 10 seconds. Feels like 10 years. 20 seconds. 40 seconds. By the time I can stand here for 40 seconds, then I practice almost impossible task, just closing your eyes and you're able to do it. So my eyes are closed. I'm trying to stand on my left foot. This is one of your signs of your health. When you will be able to do it, closing your eyes, standing on one foot, hand is behind in a prayer pose. It feels very difficult initially, but again with the practice, you'll be able to do it. This will bring a tremendous amount of structural balance for your body and mind. Again, I'm on my right foot, practicing for a while, 10 seconds, 20 seconds, 30 seconds, 40 seconds. Then I see I can close my eyes and able to stand on my right foot. Initially you will see your one side feels easier than the other side. So what you will do, you will be doing little longer on the side, you're feeling little uncomfortable. Generally for us, we feel a little uncomfortable on the side of our non-dominant side. I'm right-handed, right-footed. I feel a little uncomfortable on the left side. From here, putting your hands to the back, see my hand is going high up again because I'm in a relaxed, I'm in a balancing poses. You can do tree pose, equal on both sides. Here in the top, feet is below your knee, above your knee. You are in a tree pose, balancing pose, and here, when you are relaxed and balanced, you can do little Kapalbhati Pranayama. To the opposite side. Left foot below the right knee, left foot above your right knee. Balancing, very, very important balancing poses. Say, even in a warrior pose. You can do it. You can put one hand in the front, left hand in the back, holding your knee. This is your Natarajasana, dancer's pose. You also can do this in a warrior 3, Virabhadrasana 3. Natarajasana. To both sides, balancing both sides, structural balance, body and mind working simultaneously. Triangle pose, Trikonasana, is another wonderful balancing asana. It also massages all the intra-abdominal contents. Remember, all that this is comes from here, intra-abdominal contents. It causes the side stretch, lateral bend. Lateral bend improves your cardiac function. It increases the ejection fraction. Back bend, lateral bend improves the ejection fraction. Right foot, turn it to the right side. Very gently and easily, hands on both sides. Slowly touch your right knee. Let the left hand go high up. Don't push yourself. Slowly drop your hand down, how far you can come, and this hand is going to high up. Body goes to the back. Close your even eyes and be comfortable and in a triangle pose. It's very relaxing asana. When you get up, put your one hand in your hips. Slowly use your hand to guide your body to go forward. You can feel after this a good, relaxing, balancing asana, structural balance, your breath becomes effortless. Your respiratory rate comes down. Now you're able to breathe in with a count of 4 in, count of 8 out effortlessly. You'll be able to breathe in, count of 6 in, count of 12 out. For us, we're able to do count of 10 in, count of 20 out. Easily. Because of this relaxation and structural balance of a physical body. Remember, when you're tight, when you're stressed, when your mind isn't chattering, what happens? You get a rapid, shallow breathing, which is the root cause of many of what this is. I stayed and lived with the yogis, and I have seen when they are sitting next to you, when they are breathing, you don't even hear anything that they're even breathing. Turn your left foot out. Remember, structural alignment will come to you. Don't push for your structural alignment. You know the asanas, then you go step by step. And also, in a yoga therapy, you are not mastering the asanas, you're using the asanas in stages for its therapeutic benefit. Left hand touching your left knee, right hand is going high up, wherever it can go. Left hand will slowly come down, and right hand is also going to go high up. Body is going here, right hand all the way high up. At the level, it looks like a triangle. You can close your eyes and you can get very relaxed in this asana. Get up again, put your hand in your shoulder, use your left hand to guide your body. So these are a wonderful structural balancing posture. Once you do this structural balancing postures, you will see that you come to a therapeutic component very quickly. You are in a yoga therapeutic module now. So this was a wonderful practice. We started doing a short segment of practice at a time, so you will be able to do it at home. These are all the asanas which we do for our regular practice. Our regular practice starts with a relaxation of our smaller joints, relaxation of our hands, wrist, elbows, shoulder, neck, upper part of the body, toes, feet, ankle, knees, hips in the back. Then you do the sitting down, grounding asanas. Then you're laying down, face up, standing up, balancing asanas, and keeping our posture straight. So, it was a wonderful practice. We'll be coming back every Saturday and are trying to do more and more focused yoga therapy practices for different conditions. And also remember, yoga therapy is not a reductionist practice. A reductionist practice is our Western medical practice, yoga therapy is a holistic practice. Holistic essentially means that we drop the W out of the whole. It means it will create our whole body, a profound level of relaxation for your body and mind. Thank you for joining today. We'll come back again in next Saturday for another session for yoga therapy.